Tantor Audio, a division of Recorded Books, presents Loving Someone with Anxiety, Understanding and Helping Your Partner by Kate N. Thieda, MS, LPCA. Narrated by Callie Beaulieu. Publisher's Note: this publication is designed to provide accurate and authoritative information in regard to the subject matter covered. It is sold with the understanding that the publisher is not engaged in rendering psychological, financial, legal, or other professional services. If expert assistance or counseling is needed, the services of a competent professional should be sought. Introduction. Loving someone with anxiety can be both tiring and frustrating. It may seem as though no matter what you do or say, it's never enough to help your partner relax and feel safe. You may find yourself living a lifestyle that you never intended because you're accommodating your partner's anxiety. Whether your partner has the kind of everyday anxiety that all humans experience or struggles with a diagnosable anxiety disorder, this book can help. Do any of the following situations sound familiar? Do you constantly reassure your partner that the worst-case scenario is not actually going to happen? Do you participate in rituals with your partner that seem strange or unnecessary, such as washing your hands a certain number of times a day, arranging items in the pantry or closet just so, counting objects or steps, or checking the door locks and windows numerous times before leaving the house or going to bed? Do you take on responsibilities that your partner once handled because she's unable to leave the house or afraid something will happen if she does? Do you check areas where your partner will be ahead of time for feared objects, such as snakes or insects? Are your activities with your partner limited by a need to avoid elevators, heights, air travel, and so on because of your partner's fear? Do you feel helpless when your partner has a panic attack? Do you call your partner's supervisor to make excuses about why he isn't at work when the real reason is that he's too anxious to go? Do you walk on eggshells so as not to trigger anxiety in your partner? Do you avoid intimacy because your partner has insecurities about her body? Do you wonder if your relationship can survive your partner's anxiety? If you said yes to any of these questions, you are not alone. Anxiety is one of the most prevalent mental disorders in the United States. An estimated 18.1% of American adults experience the effects of anxiety disorders each year. Based on the current population of the United States, that's about 43 million people. Even more people have anxiety that doesn't meet the criteria for an official diagnosis, but impacts their lives nevertheless. When you add in partners, family members, and friends whose lives are touched by the anxiety of those they love, the number of people whose quality of life is impaired by anxiety skyrockets. In addition, not everyone seeks professional treatment for anxiety, which can cause needless suffering for both them and their loved ones. This book is filled with practical explanations, examples, exercises, and advice that will allow you to help your partner with his anxiety and keep your relationship and your own sanity intact in the process. The emphasis is on working together as a couple to resolve issues in your relationship that may be fueling anxiety. However, I also recommend that you seek help from a trained mental health professional, as specialized treatment can be crucial for recovery, especially with certain anxiety disorders. In addition, anxiety often co-occurs with other mental health issues, including depression, substance abuse, and eating disorders, making professional treatment all the more important. Your support is an essential part of your partner's recovery from anxiety, and your knowledge and understanding of what's happening for your partner may make recovery easier. How this book will help. While listening to this book, you may be searching for ways to help your partner overcome her anxiety. You definitely will learn strategies and lifestyle changes that can reduce the negative effects of anxiety on your relationship, but this isn't a step-by-step manual for fixing your partner. Instead, we'll focus on ways you can work together as a couple to better understand what anxiety is, how it's affecting your relationship, and what steps you can take to improve your lives. Chapter 1 explains the difference between everyday anxiety and the 6 anxiety disorders currently diagnosed by mental health professionals. It includes case examples that illustrate what each anxiety disorder looks like in real life and discusses the thoughts and behaviors that anxious people contend with on a daily basis. Chapter 1 wraps up with an explanation of medications and therapy approaches used to reduce or eliminate anxiety. The focus of Chapter 2 is on how anxiety impacts romantic relationships, including effects on work and home responsibilities, socializing, sex, and parenting. While you may have realized that your partner's anxiety has changed the shape of your relationship, taking time to assess the ways both of you have learned to accommodate the anxiety may be eye-opening. You and your partner may discover that your lives are controlled by anxiety rather than you controlling it. Chapter 3 is specifically for you as the supportive partner of an anxious person. The writing exercises in this chapter invite you to explore your feelings around your partner's anxiety. For many people, these feelings include frustration, anger, loneliness, sadness, guilt, and, yes, anxiety. Taking the time to focus on your reactions to your partner's anxiety will help you identify opportunities for you and your partner to make changes. This chapter also introduces the idea of accommodation and how seemingly helpful behaviors can actually make an anxiety problem worse. Chapters 4, 5, and 6 dive into the challenges of communication and strategies of coping with and reducing anxiety. All 3 chapters offer a lot of practical advice and many effective techniques. Communication is a tough topic for most couples, whether or not anxiety is an issue. Therefore, Chapter 4 focuses on skills for effective communication and suggests ways to practice these techniques when communicating with your partner, whether to resolve an issue that's come up between you or because you need to broach a difficult topic and don't want to generate needless anxiety. Once you've learned these techniques, Chapters 5 and 6 will help you and your partner decide how best to respond when anxiety is present. Chapter 7 explains some lifestyle changes that can help to decrease the impact of anxiety. You and your partner may not have given much thought to how certain foods or beverages, lack of exercise, technology, and media can increase your partner's anxiety. The information you learn in this chapter will challenge you to take charge of your lifestyle and think and act differently. Finally, Chapter 8, like Chapter 3, is specifically for you. Being a caregiver is hard work, and you may feel as though you aren't getting a lot of support. Therefore, this chapter discusses how you can take care of your mind and body so that you aren't in danger of caregiver burnout. My hope is that once you have listened to this book, you'll feel knowledgeable about your partner's experience with anxiety, and that you'll also feel prepared to handle the variety of sticky situations that anxiety can create in your relationship. I also hope that it will help you be mindful of your own thoughts and feelings and support you in your own self-care. Your partner is lucky to have someone who cares enough about his or her well-being to commit to listening to a book about anxiety. If the two of you work together as a team, you will notice positive changes in your lives and relationship. Chapter 1. Understanding Anxiety and How It's Treated. Everyone has anxiety. Who hasn't experienced a racing heart, sweaty palms, a jumpy stomach, shortness of breath, trouble sleeping, restlessness, or a mind that just won't quiet down? Anxiety is a normal occurrence that alerts the brain and body that something isn't right. It would actually be detrimental if we didn't experience anxiety on occasion, because then we might not react appropriately to genuine threats to our safety or well-being. Even though everyone is subject to occasional anxiety, it can be difficult to watch a loved one struggle with excessive anxiety that clearly interferes with his enjoyment of life. You undoubtedly want the best for your partner, and seeing him be so affected by his worries can be wearing. Plus, it can be difficult to protect the relationship and your own quality of life from negative impacts due to your partner's anxieties. This can lead to frustration, anger, sadness, guilt, loneliness, and more. In addition, you may feel sympathy with your partner and overextend yourself in efforts to alleviate his anxiety. Perhaps you feel pressured to make everything just right, but also feel as though you'll never be able to stay one step ahead in preventing or even figuring out what might trigger anxiety for your partner. You may have known all along that your partner had a tendency to be anxious, but living with the effects of that anxiety every day takes a toll. By listening to this book, you're taking steps toward getting a better handle on what's going on with your anxious partner and how you can improve your relationship so that anxiety isn't the focus. No one wants a relationship where every decision is made on the basis of the other person's anxiety. Anxiety puts a lot of limits on life. You and your partner deserve better. What is anxiety? While we don't know exactly what causes anxiety, we do know that the capacity to feel anxiety is biologically hardwired into us. Some people are more susceptible to feeling anxious than others, but as yet there isn't a definitive biological explanation for this. In addition, how people react to anxiety is a combination of many factors, including genetics, life history, self-esteem, past exposure to stress and trauma, current medical and psychological conditions, and previous experience handling stress, just to name a few. As a result, anxiety is a highly subjective experience, meaning each person feels it uniquely. What may trigger only a mildly anxious feeling in one person can result in a full-blown panic attack in another. Anxiety is considered an emotion, and like most emotions, it can vary in intensity. At low levels, anxiety is adaptive, meaning that it drives positive outcomes, such as encouraging you to pay your bills on time or to work a few extra hours in order to meet a deadline. Higher anxiety levels, on the other hand, can set off a chain of events that can have significant negative physical and psychological effects. One thing that distinguishes adaptive, everyday anxiety from more problematic anxiety and diagnosable anxiety disorders is whether the anxiety resolves when the stressful situation is over or continues, even in the absence of an imminent threat. I'll discuss this distinction in detail later in this chapter. For now, let's discuss the common anxiety symptoms and what those signs mean. Common anxiety symptoms. Although the experience of anxiety is highly individualized, certain physical, behavioral, and emotional symptoms are common, as are certain thought patterns. As you listen to the following sections, think about whether you've observed any of these signs in your partner when he's feeling anxious. Physical signs of anxiety. Common physical symptoms of anxiety include a racing heart, excessive perspiration, trembling or shaking, feeling restless or keyed up, fatigue or problems sleeping, shortness of breath, chest pain or tightness, nausea or diarrhea, upset stomach or butterflies in the stomach, dizziness, chills or hot flashes, and numbness. Another physical sign is an exaggerated response when startled, like jumping a mile if someone says something to you from behind when you didn't know anyone was there. It's important to note that these symptoms are natural responses to normal anxiety and don't necessarily mean someone has an anxiety disorder. Rather, the severity, duration, and effects of these symptoms are key factors in determining whether people are experiencing an anxiety disorder or just a typical response to anxiety. Behavioral signs of anxiety. How your partner acts when he's experiencing anxiety can offer a lot of clues about what's going on for him internally. Some common behaviors of people who are anxious include avoiding places or events that trigger anxiety, such as bridges, elevators, or parties. Fleeing situations that make them uncomfortable, such as a movie theater or a crowded restaurant. Performing compulsive behaviors repeatedly, such as washing their hands time and time again or checking the door locks a precise number of times before going to bed. Limiting outside activities by not leaving home or only going to a few specific safe places, and engaging in risky, self-destructive behaviors such as drinking or taking drugs. Ironically, even though your partner may feel as if these behaviors reduce his anxiety, they actually make it worse. Emotional signs of anxiety. As mentioned, anxiety is an emotion, and it can evoke a lot of different feelings. Common words your partner might use when trying to describe his experience of anxiety are worry, apprehension, fear, dread, uneasiness, distress, feeling overwhelmed, panic, pressure, terror, jumpiness, stress, and edginess. Your partner may also say he can't describe what he's feeling or might simply say, "Something isn't right." These emotional responses to anxiety often arise due to thought patterns common among people with anxiety, so let's discuss those. Common thoughts that signal anxiety. The thoughts people experience when feeling anxious are commonly referred to as worry. Everyone worries sometimes, but people who are experiencing persistent anxiety have more worry thoughts than typical and struggle to think of other things. Here are some common worry thoughts. What if blank happens? I can't cope with this. I'll never be able to handle blank. This is too much for me. I'm going to fail. I have to be in control. I might as well give up now. This isn't going to work no matter how hard I try. Everyone is going to laugh at me. I must be going crazy. Again, people can have these thoughts and not have an anxiety disorder. To understand the distinction, let's listen to the difference between everyday anxiety and a diagnosable anxiety disorder. Everyday anxiety versus anxiety disorders. It can be a fine line to distinguish between everyday anxiety and a diagnosable condition. Often, the distinction hinges on whether people describe symptoms of anxiety that interfere with their quality of life, are pervasive, and negatively impact their performance, whether that's in one area of life or across all situations. For example, if your partner has a big presentation coming up at work soon and has been working extremely hard to pull it together, he might be feeling anxious. Symptoms of that anxiety might include having trouble sleeping, being irritable and impatient, and having worry thoughts about what might go wrong. This could be everyday anxiety, or it could be a sign of an anxiety disorder, depending on how long the symptoms have been going on, the severity of the symptoms, and whether they resolve after he gives the presentation. If his symptoms do go away afterward, he was probably experiencing everyday anxiety in response to a stressful situation. If he still struggles with his symptoms afterward and also feels anxious about other life situations, it might be a sign of an anxiety disorder. Aaron Beck, an eminent psychiatrist and early developer of cognitive therapy, describes people with anxiety disorders as having a hypersensitive alarm system. In his view, they are so sensitive to any stimuli that might indicate imminent danger that they constantly warn themselves about potential danger. Unfortunately, almost any stimulus can trip the alarm, and as a result, they are in a constant state of anxiety. It's estimated that over 43 million Americans have an anxiety disorder, or almost 1 in 5 adults. So whether or not your partner has been diagnosed with an anxiety disorder, he's far from alone. Many others have similar difficulties with anxiety. The good news is that anxiety disorders are among the most treatable mental health conditions. The possibly not so good news is that many people choose not to consult a mental health professional about their symptoms and suffer needlessly as a result. In the following sections, I'll describe the major anxiety disorders. If your partner has been diagnosed with an anxiety disorder, the discussion of that disorder may give you more insight into what your partner is experiencing. If your partner doesn't have a diagnosis, please understand that this information shouldn't be used to attempt to diagnose your partner. Only a trained mental health professional can do that. Nevertheless, even if your partner hasn't been diagnosed or doesn't qualify for an official diagnosis of an anxiety disorder, this discussion and this book will still be relevant and helpful. Worry or rumination. Both worry and rumination are persistent forms of negative thinking. Worry thoughts are fixated on the what-ifs of the future, while rumination involves being consumed with unpleasant thoughts about past events. Another difference between the two is that worry is usually focused on danger, whereas rumination is entangled with hopelessness, failure, and loss. People who ruminate have a higher risk of depression. Types of anxiety disorders. The American Psychiatric Association has identified 6 types of anxiety disorders: generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, post-traumatic stress disorder, social phobia or social anxiety disorder, specific phobias. Each of these disorders is diagnosed by trained mental health professionals using criteria outlined by the American Psychiatric Association in the Diagnostic and Statistical Manual of Mental Disorders. As you'll learn, there are overlaps in the criteria for these disorders, but also characteristics that make each condition distinct. In addition, it isn't uncommon for people to be diagnosed with multiple anxiety disorders or to have another mental disorder along with an anxiety disorder. Having 2 or more diagnosable mental or physical health conditions is referred to as comorbidity. In addition to describing each of the 6 anxiety disorders in the following sections, I've also provided brief real-life examples. Generalized anxiety disorder. Linda is a 47-year-old proprietor of a small business. She feels like she's constantly worrying about everything. Is her business making enough money? Will she and her partner Bill be able to pay for their daughter's college tuition? Is her fatigue just because of working too much, or does she have some mysterious disease? What if her taxes are audited? What will she and Bill do if their house suddenly needs a major repair? Despite knowing that many of her fears are unfounded, Linda struggles to control her thoughts and relax. Bill does his best to relieve her worries, reassuring her that everything is fine and nothing bad will happen. But it seems like no matter what he says, it's never enough. Linda is a typical example of someone who might be diagnosed with generalized anxiety disorder, GAD. People who have GAD tend to go through life chronically worried, even though there's little or no basis for their concern. People with GAD anticipate disaster and worry excessively about things that probably will never happen. Concerns about money, illness, relationships, or work problems dominate their thoughts. For some, the thought of just getting through the day can be overwhelming. People with GAD usually realize that their concerns are excessive, but they still struggle to let go of their worry thoughts. In addition, people with GAD often have a comorbid disorder, such as another anxiety disorder, depression, an eating disorder, or substance abuse. People with mild GAD can usually hold down jobs, take care of their daily responsibilities for the most part, and have typical social relationships. Those with more severe GAD may have trouble with everyday tasks. Avoiding specific activities or situations, such as riding an elevator or driving, isn't a symptom of GAD. Rather, these are specific phobias, which I'll describe shortly. GAD usually develops gradually. It can appear at any point in a person's life, but is most commonly diagnosed between childhood and middle age. Genetics may play a role in whether a person has a predisposition toward developing GAD, and women are twice as likely as men to be diagnosed with GAD. Obsessive-compulsive disorder. Emily is a 36-year-old mother of 2 small children. She finds herself having the urgent need to wash her hands many, many times a day, especially after playing with her kids outside, going out in public with them, or doing something that seems dirty to her. If she's able to wash her hands exactly 28 times, she feels better, until the next time she encounters something that might have germs on it. Her hands are chapped and often bleed from the excessive washing, but she feels unable to reduce the number of times she washes. Her partner, Sarah, has expressed concern about Emily's need to wash her hands constantly, but hasn't been able to persuade Emily to stop. Emily's urgent, uncontrollable need to wash her hands excessively is a result of her struggle with obsessive-compulsive disorder, OCD. People with OCD have obsessions, distressing, reoccurring thoughts that compel them to perform rituals, compulsions, in order to relieve their distress. Unfortunately, these rituals usually end up controlling the person, making things worse instead of better. Performing the rituals isn't pleasurable, but those with OCD often feel as if they have no other option for relieving the anxiety associated with their obsessions. It's common for people to joke that they have OCD because they're rigid about how they do certain things, such as following a set routine in the morning because they fear that if they don't, they'll forget to do something or be late for work. The difference between a ritual that isn't obsessive and one that's driven by OCD is that people with OCD become extremely upset and are often unable to function if they can't perform the ritual. Rituals overtake their lives, whereas those who don't have OCD can adapt and go on with their day even if their routines are disturbed. Contamination fears and compulsive hand-washing are just one example of how OCD manifests. Other common examples are a person who is obsessed about safety and, as a result, locks, relocks, and checks all the doors and windows in the house over and over again before going to sleep at night.
Sample complete. Ready to continue?